So wish everyone luck. And so I would love to have each of our 5 judges introduce themselves. If you guys maybe just want to go down in order of the slide. So Kurfi, if you wanted to begin.
Hi, did you hear me?
Sorry, I think we had you muted. You should be good to go now.
Oh, so I said, my name is Kurfi Abubakar. I'm a medical doctor with a specialization in public health and an MBA International Healthcare Management. Currently, I am the head International Collaborations Division in the Nigerian National Health Insurance Scheme, NHIS.
Thank you. Let's have Guillaume, I'm sorry, I'm pronouncing your name wrong. If you could introduce yourself.
No problem.
Yeah, this is Guillaume Ambla. I'm based in London, and I'm an investor and advisor to startups in fintech, in deep tech, and impact investing. And impact investing includes digital health. Overall, I have 5 startups in Africa, and 2 of my global startups are based in Africa. And I'm actually an alumnus of Misty. So I was among the first batch of Misty some 30 years ago. It was not in Africa, it was in Japan. It was good fun.
Thank you. Let's have Aminata, if you want to introduce yourself.
Hi, I'm Aminata. I'm the CEO of Orange Sierra Leone. So Orange is one of the largest telco in Africa and Europe, as well as mobile money. We do a lot of digital finance services. I'm a Sloaney 2013 Legatum Fellow and former entrepreneur back at my MIT time. So I feel you guys, good luck.
Thank you so much. Jacques, if you want to introduce yourself.
Yes, hi, good morning from Boston. Jacques Podenou. I'm a cardiac surgeon at Beth Israel Deaconess, faculty at Harvard Medical School, and originally from Ghana.
Awesome. And then last one, Heather, if you would like to go.
Am I good? Hi.
Oh, yes,
yeah, no problem. Hi, everyone. I'm Heather. My background is in public health. I have my doctorate in health systems from the Harvard T.H. Skin School of Public Health, and I am an associate director at ID Insight, based in DC.
Awesome. So I'm actually just going to stop sharing and reshare for a second because someone annotated on the screen and I can't get it to go away. So that's going to get annoying. So 1 second.
Only you have to add.
All right. So quickly, just to go over how you raise your hand again, it's the same as when we did our pitches. So if you're the one who's presenting, click the raise hand button. I will ask you to unmute. You have 3 minutes to do your pitch, and then you will have 2 minutes for the judges to ask you questions. Judges, since we only have 2 minutes, it's likely that we will only have time for about 2 questions, but if there is more time, I will let you all know so that you can ask more questions. Okay, so up right now is Team Fortum, number 5. If you want to raise your hand, whoever is presenting. Okay, I'm not sure. Rick, are you the one presenting? Oh, it's Dennis, okay.
I'm
unmuting you, Dennis. There you go.
It's me.
All right, so you can begin, and Josh, if you're timing, that'd be great.
If folks are not presenting, can you turn off your video if you haven't already? looks like most people have, but.
And also, please don't raise your hand unless you're the one who's presenting. Thank you. All right.
Mic check.
And
My name is Dennis Murage. I am from Nairobi. I am a resident software engineer at Andela. I am here to present on behalf of Team Fortem. I will start by defining the problem. And when we look at the problem that is there, the problem is not the disease itself. It's not even in the population. It's the spread. You know, the problem is the spread of the virus. So basically, what we're asking ourselves is, how do we contain the virus? Next slide, please. Next. We noticed that. Well, could you please go back? Go back, please. Please. Could you go back?
Sorry, I'm trying.
All right. Okay, I wanted us to focus on the statistic that says we are aware that 42% of Africans live in the sub-Sahara. And this is where we see a greater risk of mass contamination. The people are less prepared of an outbreak. They live on less than $2 a day. They are less prepared to do things like keep their personal health and that. So this area presents not only a risk for the people living in this population, but also for the rest of the world as a whole. So me and my team, we are going to present a solution that we think is going to impact a lot of people living in this population. The solution is we are going to build a mobile app that is going to form like a system of health practitioners from all from the private and the public sector, where they are going to we are going to assign them guys from these populations, and they're going to provide the care and the support that they need in terms of supplies. And we are going to form a team that will be backing this network and enabling this network using our mobile application that we are going to build as a team. So basically, that's the solution that I'm pitching to you guys, and I have time for taking questions from the judges.
Judges, you can just feel free to unmute yourself and ask any questions.
So what's specific about your solution? Because a lot of people.
The most specific thing about my solution is that it is going to involve the network making a pool of health workers that will be running on the mobile platform and reaching out to people living in the sub-Saharan Africa and providing them with the care and support that they need to avoid the spread and mass infection.
Hi, this is Heather. How does the solution help to identify or deal with the actual overcrowding and the inability of people to space themselves?
Well, the actual overcrowding.
Hello.
The actual overcrowding is a problem that is beyond our scope. In this case, we are simply targeting those guys, those people among the population who are infected and and they present this point of mass contamination because one of the things that is lacking there is the space for isolation and also the funding. So our team will just provide the care that we need to identify those guys who are infected and provide the treatment that they need.
Great. We're at time. Thank you, Dennis and team.
So, sorry, what is the team number again?
14. Team 14.
14. 1-5.
No. It's
5.
5.
5.
Yeah. Okay. Thank you, Dennis. All right. Let us go to the next team. Sorry. Okay. So we have team number 40. Can you please raise your hand if you would like to present? Okay, Prince, you're on. So you have 3 minutes.
Okay, my name is Prince. I'm an HR practitioner and trainer in Nigeria. My team, I'll be representing team. Can you hear me?
Sorry. Yes, we can hear you.
Yep.
Oh, okay, so I'll be, okay, this is not the updated slide. Well, okay, I'll be representing team flattening cities. So our primary focus will be people who are suffering or who suffered from COVID-19, and commercial sex workers and as well the general public. Our assumption is that we are able to secure 75% support from the community, and the design and implementation of solution would take us 2 weeks. Please, next slide. Okay. Okay, this is, sorry, this is not the updated slide. I updated the slide before now.
If you updated it after 10:30, that was the deadline. So we took whatever was in there.
Okay. Okay. So our problem is, the problem we are looking at is to solve the stigmatization and marginalization of people who tested positive of COVID-19 and uncontrolled movement of commercial sex workers living in deprived and overly populated communities. We identify this as a problem because the first problem for us will definitely increase the spread of COVID-19 in the community, because these people who are stigmatized, of course, will be, for other people, they will be unable to share their test status to the community. And of course, we've had cases of them visiting the hospital without sharing their appropriate test result, and unfortunately spreading the virus through that. And for commercial sex workers, right, because of the living conditions as well, their movement is not controlled. They end up spreading this virus within shanty communities and overly populated communities. So our solution will be to, please, next slide. Next slide, please. All right, so our solution will be to create publish courses on YouTube that will first, sorry, can you go back?
You only have 30 seconds left, just so you know.
Okay, so our solution will be to create and publish courses on YouTube that will educate people on accommodating persons suffering or who have suffered COVID-19, and also will collaborate with e-commerce food vendors to secure food donations and water that will distribute to commercial sex workers living in communities. So the two stakeholders we'll be working with will be Jumia Food, right? Jumia Food has a lot of food vendors on them, and as well as publishing and posting our courses on YouTube.
Sorry, your time is up. We have to keep moving so everyone can have a chance to present.
Hi, thank you for your presentation.
A question?
Yes, I have a question, please. I would like to know what is your alternative, given that 80 to, I would say, sometimes more than 80% of the population don't have access to the internet.
Okay, well, the two focus areas that we are working with, which is Nigeria and Sierra Leone, current data rate for Lagos, for instance, is about about 10 million. So at least we are able to, if we are able to reach 50% of the population of these cities, that will mean success for us. Of course, there are persons who we can't reach out to because they are not connected to the via the internet. That's through YouTube. Will definitely be able to achieve the success rate.
Yep. Sorry, we are at 5 minutes.
And a question? A question, please.
Yes.
Sorry, we're at 5 minutes. We have to continue with the next presentation. Otherwise, everyone won't be able to go.
Yeah, but Kurfi, for the next presentation, you should ask the first question. So for the judges reference, that was team number 40 that was before. So now we are at team number 3. Can you raise your hand if you are presenting for this team? Is anyone presenting? Okay, since no one is raising their hand, we're just gonna have to move on. Okay. All right, so we have team number 9, Roots. Can you please raise your hand if you are presenting? Thank you. Okay, Adeji, you're unmuted.
Okay, the slide, please. Okay, so my name is Adedeji. I'll be representing Team Roots. My partners are Emmanuel Abba and Sayan Putatunda. Next slide, please. Okay, so the big problem actually is misinformation in slums across Africa. And for us, I mean, I was watching the news the other time and you get some people that were poisoned by taking chloroquine because they believed that that was the cure for coronavirus. And for me, the big problem actually is the source of the information. People that live in slums usually depend on friends and families, religious houses, recreational centers like liquor pubs and bars and things like that. Next slide, please. So I believe we have a solution for that. Next slide, please. So basically what we have is Roots, which is an information distribution system driven by the community influencers that would pass the information directly to the grassroots. Now, the truth is they hold these people as high esteem. So for us, it's, if you empower them with the right information, they can move that information directly to the local public. And also feedback can be gotten back from the influencers. And even we would also deploy local field workers and also leverage technology to get information directly from the local public. Next slide, please. So basically how this will work is we will partner with FMCGs and a couple of other companies, alcohol companies and religious institutions and community leaders who haven't been, I mean, the FMCGs haven't been too impacted by the coronavirus. I mean, people selling milk and sachet milks and things like that. And we would empower the religious houses, say the leaders, the pastors and things like that. And we will partner with them via SMS and send them the right information and set up flyers and posters and all these kind of things. And we will, next slide, please. And so if you take a slum like Makoko, who has 85,000 people with 5 people per household and 50 religious houses, next slide, please. You would notice that one religious person can actually empower 200 unique households with information. So if you take 50 of these people and you can empower 10,000 people, and 50% of these people are able to share that with the next set of people, you will be able to empower 75,000 people. Next slide, please. And I mean, if you can get 20,000 of these influencers, I mean, one church alone has over 14,000 in Lagos alone, I mean, in Nigeria. So, I mean, if you can empower just 20,000 of the pastors or the community heads, you'll be able to empower 30 million Africans. So I enjoin you to join us in this party to help save as many lives as possible. That's it. Thank you.
So you mentioned influencers.
Yes.
What percentage would be through words of mouth?
Yes.
And what percentage is through the internet?
So a huge portion of the slums actually go to churches, or when they go to their friends and friends around their area, that's where they get information about how the corona works or how it affects people. So in literal sense, it would be the pastors using public address systems, using the phone numbers that they've gathered from the community and sending out the right information to these people.
So do you factor in literacy rate here?
Wait, what'd you say? I didn't hear that. I didn't hear that.
I think he asked about literacy rates. Did you factor that in?
Yeah. So the great thing about using community heads.
Do you factor in the literacy rate of the people?
So I was going to say the great thing about using community heads and local people for sharing information is they understand their people, they understand the language, they understand how to pass this information to these people. I mean, they've been passing the word of God to these people already in their communities in the different languages. Same thing with the community heads. So if you empower those people to send the right information to these people, I think you could help to solve a huge misinformation problem within those areas.
In your team, what expertise do you have
so I have
to decide the information to communicate to the influencers?
Okay, so I have an IT background. I also have sales background. Emmanuel has an engineering background, and Sayan Putatunda has data science and also has worked with the people, some social work. So, I mean, together, I think we're a really great team.
All right, we are at time.
Okay, thank you.
Thank you.
What was the number of this team? This was team number?
This was team number
9.
Yeah.
Yeah, it would be helpful also if the teams, if you can just say your number at the end of your presentation so the judges know. Thank you. All right, so we have team number 61. So if whoever wants to present can raise their hand.
Yeah, it's me.
Okay. All right.
Yeah. Yeah, so my name is Salis Gerba. I'm a senior lecturer with the University of Pretoria, Department of Mathematics. I'll be representing on behalf of my groups. You can see the names there. And our contribution here is just to make assess the impact of non-pharmaceutical measures, that is using mathematics, trying to do some modeling aspect of that is to assess the transmission dynamics of COVID-19. So next slide, please. So these are the research objective or the problem, that is to assess the transmission dynamic of COVID-19 and trying to make some prediction what will happen. Like you can see the model that they are building in other countries to make predictions. What will happen in the next few weeks or few months? The idea is to try to see how we can flatten the curve. That's the first thing. The second thing is to determine the impact of those non-pharmaceutical interventions, like this social distancing, using face masks, quarantine, and isolation, especially in those limited countries with the limited resources. You see, so the easiest way to try and see how they can just flatten the curve or reduce the curtailing the disease is by trying to use non-pharmaceutical interventions. And the target market for this MIT COVID-19 challenge is Africa. Yeah, next slide, please. Yeah, so at the moment we just come up with this simple model. You can see that we try to, so we just take a case of South Africa. So what we did now, we just tried to divide the total population into seven compartments. You can see that we have the susceptibles, and then we have the exposed, those people who just get, exposed to places where we expect that there is coronavirus, and then among them we have this asymptomatic. Some will get infected and they will be asymptomatic, and then we have the quarantine, those that, like now, anybody who comes to South Africa must go into this quarantine for 14 days. So we have the symptomatic, those who have the clinical symptoms, they recovered, and the hospitalized one. Next slide. Yeah, so with, from this flow chart diagram, we came up with this model, and you can see that we have the cause of infection. So in this case, that's the idea. What we are trying to do, you can see from lambda, the first infection, we have the efficacy of face mask and the compliance with the face mask. So we are trying to see the percentage that you must use face mask before we can be able to control the disease, and at the same time, how the percentage of people that must comply with social distancing for it to be effective in curtailing the disease.
You're at time.
Yeah, sorry, just next slide.
Okay, sorry, we can't let you continue because you're at time. So the judges have 2 minutes to ask you questions.
If I may, how are you going to source your data?
Yes, so,
nice of these questions, but you need data.
Yes, at the moment, actually, we get data from Johns Hopkins. You can see the curve that we have. Can you help me out? Show the curve, please. So that's some of the things that we get now. You can see that this is just a model prediction. We use the data from Johns Hopkins University, and then you can see how we try to flatten the curve. So we just take some values for the force of infection, and you can see that the lower the contact rate, the lower the curve is being flattened. So at the moment, that's our source of data.
Time for one more question.
Yeah, so this is our group members.
Are there any other questions from the judges?
So you plan to give the data to who exactly?
Sorry?
How do you plan to use the data? Once you have the data, what do you do with it?
Yeah, so we are going to make some predictions. We are going to see what will happen in the next 6-7 months in Africa, as what will happen with whether the disease will just, the number that will be infected, and how we can be able to flatten the curve, and whether these kind of control measures, non-pharmaceutical one, can help.
So is the vision to have one model for each sub-Saharan African country for the governments to use?
Yes, definitely, because the data that we have is for a particular country. So we have to make sure that each data that we have is we just make assessment for one country.
Okay, we are at time. Thank
Great.
you.
Thank you very much. Thank you.
And can you say what was your team number?
61, G61.
Okay. Thank you.
Yeah.
All right, so Tim, I see.
It's 6 or 61?
61. That's he was just saying for the previous, yeah. So 6 is the upcoming team. So I see Tim.
Hello, everyone.
You're unmuted. Great. Okay, you can begin.
Okay. Testing for the Future is the name of our team, team number 6. Next slide, please. The problem is minimizing and optimizing the human factors during the early stages of community spread. Specifically, we're focused on screening of spike temperatures. It's not being done efficiently or effectively now, and thus it poses far greater risks. Next slide, please. Who does this affect? Well, again, a lot of the discussion is around people who come within 2 to 5 meters. Our perception is it affects everyone on the planet due to globalization and public transportation. Next slide, please. Our solution. Our drones will scan densely populated areas for people with high temperatures. We will identify those people and share that info in real time with agencies that can take action locally to immediately test individuals for the virus. On an aggregate level, we will share information with government agencies so they can formulate strategic responses. We have unique IoT, healthcare, and local knowledge. For example, in August 2001, when a pro football player, Corey Stringer, died of heat stroke, I worked independently with FLIR to try to create a solution to detect elevated temperatures among college and pro athletes from a distance. The market was not ready. The world and technology are ready now. Our target market includes major cities and other government agencies. We have competition. Dragonfly and Zipline are competitors, but they're also potential partners, as are all of the logistics companies. This was tried in a US municipality, Westport, Connecticut, but due to concerns about privacy, it was blocked. The people of Westport, Connecticut are more focused on finding Charmin. The people of Africa are focused on surviving. Next slide, please. What will happen when this is implemented? Faster tracking of infected people. A huge population can be screened and important data collected. This can be shared globally. And again, we'll reduce the transmission of the virus and flatten the curve. Next slide, please. Our call to action is to help us with a pilot. 20 drones to be deployed through in an area in Nairobi called Kawangware. It is a very densely populated area of 1.2 square kilometers with a population of over 133,000. Very impoverished. We feel we can make a very quick impact on this. We'll fly the drones 7 days a week, 10 hours per day. Again, we want to do this as quickly as possible. We project we can get this up and running this year for 4 months, and a rough estimate would be a cost of $296,000 US. Are there any questions?
Okay, judges, you're free to ask questions.
Yeah, a question, please.
Yes, sir.
So knowing that, this is something that is capital intensive as far as African countries are concerned, how do you expect African nations that are struggling to afford, what to eat at this material time to be able to afford this kind of technology?
Well, the data collection has global relevance.
As a follow-up question, how many people can you test with these 20 drones during your pilots?
Well, we believe we can test 23 times as many, or detect 23 times as many infected or high temperature individuals compared with an individual tester at a mobile test unit. So the World Health
Organization, what happens once
other government agencies around the world will want to identify problem areas, not just with this pandemic, but there'll be many future epidemics and pandemics in the not too distant future, or there'll be resurgences of this. So again, this data is very valuable. So this can certainly receive support from other organizations. It will become more efficient. And then there are piggyback opportunities with, again, the logistics companies or companies like Zipline and others that are using drones for medical deliveries.
So this is quite interesting in terms of, I guess, identifying literal hotspots. What do you envision happening once an elevated temperature has been identified or registered?
That's a great question. The first course of action is to notify the local agencies. In Nairobi, they have both law enforcement and what are referred to as social workers that can respond and do some more in-depth testing, and then again enforce quarantining if necessary.
And privacy considerations?
Privacy considerations are well documented, but when you're talking about a global emergency that needs to be addressed, is privacy more important than the health and well-being of the whole community? And again, given the density of the population in these areas, they have little resources to protect themselves. So the ability to buy PEE will be a barrier.
Great, we're at time. Thank you. Team 6, testing the future.
Thank you. So now up is team number 31, Nambi. Okay, let me unmute you. Okay, I think you should be good.
Please move to the first slide. Hello. We are team Nambi. Next. We begin our journey with Namuli. Namuli is a common teenager who lives in the Ugandan village of Mende with her grandmother. She is one of the many villagers whose way of life constantly exposes them to the risks of highly infectious viruses such as COVID-19. Densely structured communities like hers operate in diverse manners and have complex anthropological systems. Next. However, the ones who work on implementing solutions are typically groups with little knowledge of community distinctions, which lead to unpredictable circumstances. In order to build sustainable infrastructures for pandemic responses, community values must be taken with the highest priority. Next. Which brings us to Nambi. In Ugandan myth, Nambi is presented as a guide. Our product attempts to fulfill that role in the African community by promoting behavioral change and sanitary practices in the community. Next. Nambi is a story-based mobile game which uses aspects of African myths and cultures as key drivers to its gameplay. Next. It will feature an avatar system to make the experience more personalized, daily and weekly challenges to provide long-term engagement of the audience, scoring systems for the user to keep track of their progress, and an integration with popular social media so that people can share their contribution to others. We envision Nambi as a program that blends with daily life to promote habits that will become a regular practice in its audience, thus approaching the problem from a grassroots level. Next. Our team comprises various experts from many fields. We plan to leverage this advantage to develop multidisciplinary methods in an attempt to blend advanced ethnographic research, medical innovation, game theories, and state-of-the-art computer science, and develop our vision into an achievable reality. Next. Early stages of development will consist of fieldwork and background research in order to design a culturally tailored platform that is mostly driven by the community with no external cultural influence. Partners of the project would mostly be medical institutions, healthcare industry, and industries that can profit from the data generated in further research in their respective fields. Next. The mobile game market is already a well-developed scene with 300 million individuals having access in Africa. Between 2014 and 2018, the games industry has experienced rapid growth from 105 to $570 million. Next. We will adopt a free-to-play model for the concept of the game, and its process of development will be closely monitored with an emphasis on keeping the platform strictly as a tool for communication, knowledge, and promotion of good health practices. Next. Thank you for your time.
Judges, you're free to ask questions.
Thank you for this presentation. This is Heather. This is interesting. To what extent is your diagnosis of the problem that people don't have information and need this gamified information versus their ability to act on information?
No, the main way we want to approach this problem is like we want to develop a certain habit in the community, and the reason we're taking games as an example is like we have colleagues that have worked in gamification before, and from their experience, when you make something fun, people tend to follow that more properly, and then if you put aspects of the culture that they already know in it, it'll be easier to deploy these solutions to the community. Did I answer your question or no?
It's a start, but I'd like the other judges to have time.
Any other questions?
Yes, please.
Okay, if there are no other questions, we can move on to the next group. Thank you, Team Namdi, number 31.
Yes.
Thanks.
All right, so we have team number 2, Coronet. Okay, you can unmute yourself, Lakshaya.
Yeah, before actually going further, I want to clarify this, that there's some sort of lag between both of our screens. So I hope you consider that. So we are Coronet, and our problem statement was, next slide, please. How might we maintain social distancing without harming livelihood, which is aimed at, next slide. Out of the 85.8% informal workforce, the daily wagers without internet access who are at a trade-off between hunger and COVID-19 during the pandemic, especially but not restricted to the densely populated African countries like Nigeria and Mauritius to prevent bulging of the curve. Next slide. So we propose Coronect, a call and SMS-based e-pass system which allows people to work and buy essentials by allocating scattered meeting times throughout the day. Let's go through Joshua, a Mason's visit to his job site to understand its working. Next slide. Joshua calls our helpline number, and after a few automated steps, he is connected to a contractor who needs work done today. After talking to Joshua, he approves his visit by an automated key press on his phone, and immediately our database checks traffic from Joshua's home to his job site and sends him an SMS containing his name, route, and time of travel, and a unique identification number, UIN, to act as an e-pass. The same is sent to every checkpoint on the allocated route. Joshua leaves his home at allocated time and taps in the UIN at every checkpoint and reaches his job site safe and sound. Now, how will this help? Next slide, please. Social distancing will prevent the spread of COVID-19. A single tap contact tracing will be possible, aiding early quarantine. Since Russia will be a thing of the past, ambulances won't face any traffic jams, and checkpoints will generate jobs for those who cannot work at all owing to the pandemic. But what do we need now? Next slide, please. Unprecedented government support to use our method and impose an innovative curfew. Help from cellular companies and transporters to aid its working, and support from local influencers to convince people. Next. Our potential stakeholders to execute the solution to its final stage are Clinton Foundation, MIT REAP, UNDP, Urban Africa, Camtech, and MIT Africa. Next. Next slide, please. We are a team of designer, data scientists, engineers, and a consultant with experience with one of Africa's largest cellular company proposing Connect. Okay, I think you just, yeah. Proposing Coronect, which can definitely be brought to reality. Thank you.
Okay, thank you. So judges, if you have questions.
What's the team number?
My team number is 2.
Okay.
What are short-term targets that you would be setting for yourself and a bit longer term to assess your support?
Okay, so the short-term targets will definitely be reducing the in places where people are really live in cramped spaces, and for people who are daily wagers, so to prevent coronavirus contamination in them. And the long-term benefits of this can be if there's like less traffic on the road, then the mileage will be higher, then overall the pollution of that area will go down too.
Okay, thank you.
So you need support from large organizations, you need support from the government. How do you see the steps in getting this support?
Yeah, can you go back to the previous slide? Can you take me to the potential stakeholders? So yeah, we plan. So these are the stakeholders. These are the partners which are partners of the present MIT hackathon. So if these people can actually help us to reach our project to its final stage, so basically, if they can promote our solution, it can definitely reach the right people.
Great. We are out of time.
Thank you.
Thank you, team 2.
Sorry, which team number?
Team number 2.
All right, so we have team 20, the new Pangea. Okay, Jeffrey, you can unmute yourself.
Like this?
Yep, great. And you can begin.
A good day to fellow judges, ladies and gentlemen. I'm from Team The New Pangaea, and I have to say this, we are all going to die. But maybe not now, not soon. As Bloomberg Business put it, $1 billion in pandemic prevention is worth $1 trillion in cure. I'll first start with the problem. Next slide. Here in Nigeria, lockdowns will soon be lifted. Are we setting ourselves up for a devastating second wave of COVID-19? What should we do? Or rather, what can we do to prevent a community spread? Next slide. Fret not. Our solution is a chatbot, a real-time COVID-19 virtual assistant available on WhatsApp. We want it to be credible, convenient, and around-the-clock solution. We want it to be effective before and during the second wave if it comes. Next slide. How is it going to work? It will have a simple interface and a user guide. And you can receive the latest updates on COVID-19 wherever you are. And most importantly, the location tracking feature. Let me illustrate to you with an example. Imagine you visited a supermarket 2 days ago, and today you receive a notification from the chatbot telling you that there has been a diagnosis of a COVID-19 patient who has visited the same supermarket 2 days ago. What this means is that there's a higher risk of you contracting COVID-19. Without the chatbot, you wouldn't know that you have come into close contact with someone who has been diagnosed with COVID-19. Next. What we aim to do is actually a 5% reduction in wave 2 confirmed cases. Can I have the next slide? We are actually aiming for a 5% reduction in wave 2 confirmed cases. We need to be proactive instead of reactive. The population of Nigeria is at 200 million. For the first wave, we already have 2,388 confirmed cases. We have calculated the cost of ICU bed and ventilator per use per person per day. That gives us an estimated cost of an average of $125. For the second wave, we're expecting at least 6,000. Assuming we save 300 people from going to the hospital, we can save $37,755 a day. Next slide. So why our chatbot? We are proposing a platform that's interactive and not just informative. We are looking to scale up with trusted influencers and religious leaders. And we look to expand to other countries after Nigeria. We want to encourage community efforts such that everyone, including you and me, can play a part in combating COVID-19. I will now conclude with a walkthrough using a short demo clip. Next slide. For the demo video, you have to click right at the center. So from what you will see in the video, you can actually initiate a conversation. Then you can receive latest updates on coronavirus. And then you can register where you are going. And so with that, I conclude the presentation from the New Pangaea. Team 20, thank you for your time.
Thank you.
How are you going to test the validity of the data that you receive so that people don't give you false information?
Yes, that's a very good question. We have actually considered it. So for the validity of the diagnosis, right? So when you're being diagnosed with COVID-19, you're supposed to, that it has to be certified by a government hospital or a reputable organization. And once you're being diagnosed, you have that letter claiming that you have COVID-19. Then you have to submit that proof through the chatbot, because the chatbot can receive pictures as well. So that's how we actually gain credible diagnosis from people.
I'm a little bit confused. Can WhatsApp itself do location tracking, or is there another parallel app that people would have that would then draw on Bluetooth or GPS to be able to do the proximity tracking component of this?
Okay, for WhatsApp itself, actually you can send the location, but we wouldn't want to compromise on your privacy because there's a lot of red tape that we have to go through. So we are doing this on a trust basis because the location that you feed in will be the location used to give you personalized data. So if you choose to lie about the data, it doesn't benefit anyone. And if you are not diagnosed with COVID-19, it won't affect anyone else as well.
And how do you plan to onboard clients, people to your WhatsApp?
Okay, so the primary pool of people we are reaching out to is actually those with smartphone with WhatsApp. And we have the numbers. We have at least 25 million users on WhatsApp. And in the case where there are people without phone or WhatsApp, We can actually make use of community leaders and even send it through call or messages. That's our plan.
Because what do you mean by the fact that you have the numbers? Gives you the
We have done our research, and there are 25 million users who has WhatsApp in Nigeria. That will be our primary base of outreach. People with smartphones with WhatsApp.
Okay, we are at time. Thank you.
Thank you.
Team Pangea, Team 20.
Okay, so we have Team 26, Innovative Skyline. Ochoche, if you're the one presenting, you're...
Hello?
Yep, we can hear you.
Yeah, should I start?
Yep.
Food is life. What happens when the source of life becomes a source of death? Next. Next. 315,000 African children die every year, and to make it worse, next. Next. 115 African adults die every hour, all due to poor food and water sanitation. People at home, but still testing positive. Is it because someone came over? Yes. Food, groceries, and everyday necessities came over. What's the issue with that, right? Well, let's travel back with our transmission cycle. Next. An infected person coughs, checks an item, then returns it. Another person comes, while maintaining social distancing, picks it up and buys it. The virus stays on surfaces from a few hours to a few days, and an average person touches their faces at least 16 times a day. You know what? Let's stay away from food, and that way we stayed away from people for 2 months. I mean, bravo, but I hate to break it up to you. We cannot last 4 days with no food and water. The great news is Innovative Skyline has the solution. Next. A mist made of biomedical ethanol, minimized concentration of citric acid and water, built into our machines. Machines that fight cross-contamination through groceries from the factory to the second you purchase them. Our idea can address the problem at the ground level, easily deployed. Next. Detoxifying portals as illustrated here for grocery stores. Next. And not to forget the large number of open markets in Africa, which is why we offered the sprinklers. Next. Next. Machines that would not cost much, especially that they would have a secret ingredient coming up. Next. How we are going to manufacture our machines using, next, 19.5 million tons of plastic in Africa that is thrown away yearly. In Nigeria, there are 3 recycling companies which we plan to use. Next. We are targeting anyone responsible for the distribution of groceries. Next. Africa. Next. I mean, the numbers speak for themselves, right? Next. There are competitors in the market, but we stand out because we are the only ones who are targeting the transmission of the virus through groceries and not just focusing on only humans. We are also helping solve major crises. Our solution is not just for today's pandemic, it's for everyday life in Africa, since Africa suffers from poor sanitation all around the year, every day.
All right, you're at time. Thank you.
Yeah, I think the slides are jumbled up, right?
Okay, well, it's the slides that were in the presentation.
Okay.
That was submitted. It was accessed through a link, so.
Okay.
There's a lot of very good ideas in your presentation, but how are you going to deploy all these machines and tools? Because you need people on the ground everywhere to deploy these things.
Yeah, we plan to deploy them through governments. The governments can be because the governments are responsible for the health of every country, and they have more access to the system because our system works from the factory until the second you purchase them. So the government can ensure laws, especially in Africa, since they suffer from poor sanitation all around the year. It's not just because of coronavirus.
Also, if I might add to that, also we target retail business owners So we intend to install these portals right at the exit and the entry points of every retail business, and also have it installed at the cash points so that these groceries are sanitized just before they are bagged. And then for the open market, we will have it installed at strategic points so that it works by sanitizing the air and the products that people buy.
And
what of
power? Oh, sorry. Go ahead.
What of the issue of reinfection at home and the issue of reliance on electricity?
So for the issue of electricity, it's going to be powered. These machines are going to be AC and DC powered, and they also have the channel through which they can use solar systems, because there's sun everywhere in Africa. So we have that channel where we can install solar systems. For example, in Nigeria, the open markets already have solar panels installed in most open markets. So we will just take advantage of that. And then we're really targeting people that are practicing all the measures put in place for prevention and are still getting infected. So if you practice all the measures and your groceries are also sanitized, then we're sure that the risk of you getting infected will be reduced drastically.
We are at time. Thank you.
Okay.
All right, thank you. Okay, team number 47, keep safe with social distance. Kimberly, it looks like you're the one presenting. You can unmute.
Can you guys hear me?
Yes.
Is my video on?
Yes.
Yes.
All right, can I go ahead and get started?
Yes.
Hi, I'm Kimberly. I'm working with Team 47, Keep Safe with Social Distancing. We're a team of medical professionals, engineers, data analysis, as well as students. We're looking at social distancing, maintaining connection and cooperation. Next slide, please. Next slide, please. Sorry. Thank you. So our objectives today is we're looking at social distancing.
It's well out of the mainstream. You know, I was raised in the Bay Area. I'm a father now.
Sorry, can someone put themselves on mute, please?
We can stand for that. And frankly, Rick,
back to objective. We are looking at social distancing and the possible negative impacts it has on both health and economics. And we're focusing primarily on South Africa to practice social distancing, even though there's many barriers such as living in a large household and being the ways to transport yourself to work, as well as relying on survival. Next, please. So the solution that our team came up with was an application, a safe living app that would encourage South Africans to practice social distancing and hygienic apps. It would be a free app that's offered on either computer or smartphone, and it would be tailored to each person depending on their age and role within their families. As we recognize that it's difficult to social distance within the family, but encouraging only 1 to 2 people going out for work, and as well as any supplies. The app would feature videos of famous leaders talking about social distancing, and that would also be tailored to the individual, looking at sports stars versus religious leaders, depending on the age group. There'd be games for children so they could learn about distancing and connect with others. Tutorials on how to make face masks and participate in other hygienic hand washing. And the
Adela, I've told you, when I'm doing something like that, you don't come close, and you came exactly when it was my time.
Competitions and able to do these hygienic acts and promoting social distancing, as well as prizes. So not only would it promote the social distancing when able to, but also keep others connected. Next slide, please. This just gives a visual representation of a few questions that would be started and to ask of the person, and then they would get specific interventions depending on their age and role. Next slide, please. A summary of just our overall product, looking at a social marketing framework. Our product is an app that really will be tailored interventions that focus on 1 to 2 family members being the ones that leave home for work or for groceries. We're going to focus in South Africa in the 5 largest cities. As urban areas, the transmission can be the greatest. Position and price, we're looking at discouraging people from attending public events and limiting the amount of people going out into society, and also keeping connected on the app. We would use offer drones for monitoring to ensure that these practices are being met. And our promotion would be through the app, as well as TV ads, flyers, banners, and radio, understanding that not everyone will have access to that app.
You're at time.
Thank you.
Thanks.
What
From the judge.
questions?
Judges have questions. You can.
How would you define success?
I would say that partly it would be just the number of users using the app and then those complying with the social distancing, as we can understand that they're not able to necessarily social distance within their home, but if we're actually making an impact where 1 to 2 people are leaving the household, talking to their friends about the app, and then staying connected on the app. So we would look at numbers within the app as well as numbers of infection to correlate.
Okay, thank you.
I'm a little confused about the role of drones.
It's a very good question. So that was brought up to help with also just the promotion and to provide incentive for the use of the drones, being more looking at, is everyone participating in it? Are they not? We didn't get into too many details as far as what would be the repercussions or if there would be any, just used more as a monitoring of if this was working.
No cameras are involved, so people don't have to worry about their privacy. And also it's basic drones, so that means it's going to be low cost to pay for them.
Great, you're at time. Thank you so much.
Thank you.
Thank you.
Team 47, keep safe.
Yeah.
Thanks.
Can I start?
Wait, hold on.
So,
I don't know. Hold on, wait. So, 1 second. There's 2 people raising their hands.
Dudah, Bilal, Dudah.
Bilal, you're the one presenting?
Yeah.
Okay. So team 37, you can go.
Hello, first I want to thank you all for this great experience. It's an added value for all of us. Let's start by introducing the team, please. Next, please. Me, Dudah Bila, my colleague Sami Shgar, we are software engineers. Faisal Dos, who is a healthcare specialist, and Hamza Sadi, who is data scientist. Please, next. The 3rd of March in Saharian province in Algeria called Wirgla discovered the first coronavirus case. The opposite of what was expected to happen. After 2 months, Wirgla is counting now only 67 cases with 0 deaths. What great result. But how? The first responsible of the healthcare in Algeria, when he was asked for the reason, he directly thanked the flight company, which had to target all the suspected people within hours and avoiding the catastrophic scenario by tracking the flight ticket of the patient. Next, please. Many solutions around the world has appeared to track and prevent the virus, especially in Asia. But a long discussion about data and privacy took place, even if the system itself is powerful enough to contain the virus. And also, the existing solutions are not adapted to those countries. So how can we prevent and rapidly contain the virus? Next, please. The solution is a mobile application for people who already have a smartphone, and a bracelet for those without smartphone or a phone at all. Next, please. The offline application doesn't need access to internet and do not share any information. By using Bluetooth connection or the QR code scan, you will be able to scan and save all the people you meet. Next, please. The app also contains everything you want to know about preventing community spread and alert this is important. And alert serves as an alert that can serve as a reminder to ask people to ask phone holders to clean their hands every 2 hours, which is important according to WHO. Also, the app can play the role of a recommendation system. Imagine you can just enter your destination and can tell you if the place is secure enough to be visited regarding the healthcare situation there. Next, please. The bracelet will allow people to save the contacts by using Bluetooth. The bracelet only contains watch, battery, small memory, and Bluetooth, which is a really cheap electronic compound. Just be happy. Government will not have access to information, and they are not shared with anyone. Please, next. Next, please. Yeah. The only way to extract information, The only way to extract information from both phones and bracelets in an edge device located in hospitals. Confirmed cases will be asked to connect by using Bluetooth, and all the meetings will be transferred to the dashboard, and the hospitals will be allowed to contact suspected persons. Think about it. Yeah, this solution does not demand a totally lockdown, which is disaster for economy, and also can contain rapidly the virus in order to avoid catastrophic situation. Sub-Saharan countries now are just in the beginning stage, just like Wergula a couple months ago. So don't forget about it.
We're going to have to move to questions from the judges. Thank you.
Yeah.
So how would you deploy your solution?
Excuse me?
How would you deploy your solution?
You just need to, for smartphones, you just need to download the app. It's gonna be available on Play Store and
I understand, but how do you get people to download the app, and who are your partners?
Yeah, we're gonna work with the phones operators, so they will just send an SMS to the link they will download, so we're gonna touch everyone. We just the SMS provider will send SMS to all the users.
So how do you plan to convince the telephone operators to do that? What's in it for them? Second question, where would you produce your bracelets, and how do you ship them to the continent?
Yeah, for the bracelets is I'm going to answer the first question before. For the SMS provider, it's a pandemic. Everyone wants marketing image and all this stuff. So the mobile operators will be a marketing stuff for them. And for the bracelet, we're gonna produce them by us, because we do have everything, and we're gonna share everything, the design and all this stuff. Those countries can get these bracelets, and everyone want to help who can get the design and can produce them. A lot of communities in Africa, here in Algeria especially, they are working on. They did a respirator, a ventilator before, so we're gonna act the same thing they did.
Yeah, we are at time. Thank you. COVID Rescue Team number 37.
Thank you. Before we go on, I just want to remind people of how they should start their presentation. So please raise your hand and stay on mute until I tell you you can unmute. Also, if you can remember to say your team name at the end, and also please only say next once, because there is a bit of a lag. So I will press next twice if you say next 2 times. So just say it once and wait a second, it'll go to the next page. Okay, cool. So we are at team 39 together. I guess Kripa, you're the one presenting, you can unmute.
Thank you, Marjani. Hello, everybody. We are team together. Betty is a teacher in Kenya. Deepika is a life scientist in France. I am Kripa, and I'm a software engineer in USA. We are today addressing the economic impact of stay-at-home orders. Next slide, please. Specifically, the problem that we are looking at is the lack of sick pay in the informal sector, and also the lack of sick pay for part-time workers in the formal sector. This leads to a lot of economic pressure for them to work despite their sickness. Consider the case of Lindy. She is a single mother in Korogocho, which is an urban settlement in Nairobi. They have, in that group, in that community, there are 70,000 people within 1 square kilometer. Like thousands of parents in Korogocho, Lindy is also the sole breadwinner. And this morning she woke up sick, and she knows she should stay home for her own health and for the sake of the community. but she still needs to feed her family and she still needs to procure medication. How will she balance these needs? Next slide, please. Our solution for this is to build a central communication portal, which we are calling the TT platform for Team Together. And what it does is ease communication of information, the flow of information. It improves and it makes service delivery more effective. The first step is it monitors Kenya outbreaks, like pulling data from individual communities, like the community center that Lindy is associated with, and it builds models of where there may be problems. And it gives this data to private companies such as Safaricom or Johnson & Johnson, who have a social mission and wish to help through in-kind and credit plan help. Next slide, please. If we start on this project tomorrow, we already have the public health data and the demographic data that we need. We need to build epidemic models to track disease spread and real-time data, granular data, block level data for hotspots. And we will deliver an accessible low bandwidth solution. This is an innovative solution with immediate impact for Lindy's family. And it also helps Kogorocho and Kenya in general by limiting community transmission. Please join us in this effort. Thank you.
Thanks. Questions from judges?
So your solution relies on people donating things, no? How are you going to onboard them?
Could you go to the previous slide? Thank you. Our solution is not motivating people to donate. There are already foundations who are attempting to do that. And Lindy's problem this morning is she needs services. And we want to keep her safe. And people don't know. Johnson & Johnson wants to deliver supplies. They don't know where to go. And we are an information portal. We improve the communication. We identify hotspots. And we help the companies who wish to help find out where they can most effectively serve. Does that answer the question, please?
Yeah.
I don't think I understand why an epidemiologic model is required as opposed to just people reporting their needs. And if a model is required, how you plan to develop that, given all the challenges with model building.
No, I mean, we do not have the expertise to build a model, and that is not what I was suggesting. People self-reporting will definitely be one source of information, but people who are struggling with their daily needs are not going to take the time out to self-report always. So we need ground data from the bottom up, and we also need whatever experts, academic experts are able to guide us in terms of where the next outbreak might be.
Okay.
Thank you for listening to us. We are Team G39, Team Together, and thanks for listening.
Thank you. All right. We have Team 62 beat COVID. So I see Mohammed, you're raising your hand. You can unmute and you can begin.
Hi all. We are on the track G, community spread, where we see the lack of information on preventive measures as the problem. Next slide. Vulnerable communities in Africa do not have access to information on how to safely navigate to the basic amenities and emergency services. And they also do not have access to information on preventive measures to combat the epidemic and the spread. Next slide, please. Coming to the digital adaptation data, it shows that Africa has the most expensive internet, and more than 1/3 people do not have mobile broadband. This means 50% of the people can be reached through mobile phones, and more than 90% can be reached through radio. Next slide, please. So this is where Beat the COVID comes into the play. It's a one-stop digital solution to prevent and beat the COVID-19 crisis in Africa. Next slide, please. So we make use of smartphone application, dedicated SMS and phone lines, dedicated radio channels, and digital billboards to inform people on how to safely navigate to the nearest centers for food and safety kits and also health checkups. We make use of unique contact tracing based dynamic navigation updates. We also provide radio and mobile podcast on the preventive measures. We also have other features like automated health checkups and SOS contacts. Next slide, please. You can now access all of these features in your local language, be it the automated call lines, SMSs, recorded channels, or the single real-time app. Next slide, please. So this is one of the scenario where Clark wants to get to the food charity, and we have a background data, and we come to know that Clark is not infected and his community is not infected. Hence, once he calls, we suggest him that he take Route C, which is the low danger zone, and avoid the high containment zones like Zone A and Zone B, and we ask him to leave after 1 hour since he's 30th in the queue. Next slide, please. And this is one other such example where Emma tunes on to a radio channel for health checkup, and we give her a similar suggestion. Next slide, please. And we do have 3 kinds of podcasts. One podcast is getting people to know about the ground reality, what this coronavirus is and how serious it is. And the second one is about informing people how to make soaps, masks, and other safety kit at their homes with the available material. And the third podcast is about physiotherapy-based immunity techniques that they can practice at home to prevent COVID-19 crisis. Next slide, please.
Okay, your time. So judges, you can start asking questions.
Yeah, you said this would overcome the language challenges, but I'm unclear how it's going to do that. How is it going to be in all the relevant languages?
So there are like APIs which do provide us information on different kind of languages for mobile applications. For radio channels, you basically read a radio jockey, and we can hire or like get a local radio jockey to present this information.
Yeah, also, good day, judges. So my name is Stephanie Ade. So I just want to add to my team member, what Morali said. So even in the participant guide, there's actually a ULISA. So they have a portal where you can access like 11,000 local languages. So that's also a way of partnering with ULISA to be able to get access to all these languages to be able to communicate with other vulnerable communities or to other vulnerable communities on the importance of the preventive measures associated with fighting COVID-19.
How will you measure success?
So like how many people adopt it? That's a success.
What or what?
Like how many people adapt these applications and services?
Okay.
For the radio, how do you measure success?
For the radio, we'll be counting the TRP, like how many people are using our channel, and we'll come to know like whether we are able to succeed or not.
Beautiful.
Is that it?
And it's also an all-inclusive solution. You don't need power and internet to access it.
Okay. Thank you. What was your team number?
Thank you, ma'am. 62.
62. Thank you.
Yeah.
All right. We have team 60, EMSKE. Okay, I see you're raising your hand. You can unmute and you can begin.
Thank you. You can hear me.
Yes.
We are team EMSKE, thank you. And you can go to the next slide. So what we're looking at here, 3 of our team members here in Kenya, we have several slums around that together comprise about 1.2 million people with extraordinarily small amounts of social distancing between them, very high dense communities. Meanwhile, by the way, you can click a button again to make the photo come up. Meanwhile, the scientific research community is expending enormous amounts of effort verifying plant-derived therapeutics whose target is to reduce the infectiousness, the viral load of people. So such that even if people are in a dense community, they ought to be able to reduce their infectiousness to each other. The question is, once one of those human clinical trials results in a positive hit, then how are those plant-derived therapeutics going to be cultivated and processed fast enough to be effective on stemming the tide of infectiousness in these high dense urban communities? Next slide, please. So the solution that we've come upon is using fast computation speed in silico molecular docking studies in order to verify in advance plant therapeutics on COVID-19 proteins. So starting from seminal work by Wai-Yu Chen at the Hong Kong Polytechnic Institute, he identified that hesperidin, which is common in things like orange rinds and other sources, as an in silico hit. Next slide, please. It was actually disabling the protein called 3CL-Pro, a protease, which the virus uses to replicate itself. The target of his work was on the previous SARS from 2003, and which is found to have a practically identical 3CL-Pro protein as the current COVID-19. Now, the efficacy verification is actually a very important thing. It gates all of the work of delivery. And so all eyes are on that. And luckily, the metabolite of hesperidin called hesperitin was verified to inhibit the 3CL-Pro protein of the original SARS in vitro, that is in a petri dish. And it did so very safely and effectively. There was a wide margin before it could ever become toxic to cells, more than 2 orders of magnitude. So now a Quebec pharma company is identified the same thing and is working to initiate clinical trials of hesperidin by working with the Montreal regulatory authorities for health. Next slide, please.
We can't hear you, Rick. I think your audio has gone out. Rick? If anyone's on Rick's team, can you unmute yourself and jump on? Because we can't hear him. Hey, Rick, can you hear me?
Can you hear me right now?
Yes.
Hello?
Yeah, yes, we can hear you.
Okay, great. So next slide, please. Okay, so we've also identified that peppermint is an important slide.
Because we didn't hear.
Yeah, let me.
Rick, we didn't hear your previous slide.
Yeah.
Yes, peppermint.
Sorry,
You can hear that. Peppermint.
We're trying to accommodate all the teams, so unfortunately we can't go past 3 minutes. But maybe if there are specific questions, Rick can address them.
Okay, here for questions.
I don't know. Personally, I think we should skip his question and let him finish his thing.
Yeah, why don't we do that? Hey, Rick, just finish off.
Sure. Okay, so we've identified peppermint is also an important hesperitin source, and it's especially appropriate for a nebulized administration on an acute hypoxia patient of COVID. So that would be especially for the hospital setting. Next slide, please. After the peppermint. Good. And we've verified the safety of the nebulized approach of the peppermint extract on a healthy individual. Next slide, please. The business model allows us to produce right up to the point until the human clinical trial completes, and then we'll be able to make that available to health policymakers and health officials to distribute into the slums of Kibera and Kawangari. Next slide, please. We have a mechanical designer designing a pressurized cooking extraction process for the mango seed and the peppermint. Next slide, please. And our team consists of people who are very active in the entrepreneurial ecosystem here in Kenya, MIT trained, computer science backgrounds, and pharma regulatory backgrounds. Next slide, please.
We have top advisors, including plant medicinal companies who are Johns Hopkins trained and know the regulatory authority for getting plant medicinals through the process here into patients' hands. Next slide, please. There's been a progressively more and more media on hesperidin effectiveness on COVID, so we are just focusing that along and helping make sure that it results in a clinical trial and helping our Quebec friends to accomplish things.
Sorry, you're at time. You're over time, actually. Thank you, though.
Thank you. All right, so let's move on to team number 8, Star Solution. Is that you, Mohammed? If so, you can unmute. Mohammed? Okay, I see Mohammed has his hand raised, but he isn't unmuting. So is there anyone else on the team that wants to present?
Hello.
Yes.
Yeah, I am presenting the Team Star Solution.
Okay, perfect.
Okay, next. Next, yeah. The problem is that the people of African subcontinent, they cannot access the emergency medical services. So next. So the solution is that we are making that easy and accessible way by having a emergency healthcare system on their mobile phones by building an application, so the individuals can use it very efficiently. Next. How does it work? The services, it gives that awareness testing, virtual assistance, and contact tracing and COVID-19 updates regularly, and relaxation techniques, so that people can do it very efficiently. And next. So first, it needs a registration by their phone number and verification by by one OTP, and they got a unique ID and got a user ID, and they can do it by that. Next. So there is the awareness part. So in awareness part, in mobile application, there will be a precaution steps like wash the hands and taser, and the symptoms by which can they identify that they need to be tested for the COVID-19 and the suspected individual. And we are planning to implement a reporting system that they can reported if there any neighbor have the same conditions like this. Next. So there is the testing part. So there is in the testing part, we are use the machine learning, and we are trained a model based on this. And there was a bunch of questions by that the people answered their individual condition, and by that we define the COVID-19 that he need to be tested or not. Next. And there will be a virtual assistant which can help the people to get their nearest location of hospital and other medical emergency services by the Google Map API. We are using the Google Map API to trace the nearest medical services. Next, please. And the virtual assistants also help there to get their test ID when they are tested themselves. So, and they check their ID by the test ID. Next.
You're at time. Please wrap up.
And there will be a contact tracing also by that. The people who all meet other peoples, they can be traced by this application. Next.
Yep. Can you please wrap up? And
yeah. And there will be a COVID-19 update also. Next. And the target market is the individual in vulnerable communities. Any question? Thank you very much.
Thanks.
Which partners are you going to use to roll out your solution?
It can be said by my friend Yatambaya, because I am in the testing part also, so he can told that.
What skills do you have in your team, and have you considered a USSD version of your app?
I have the I
Please, can you
check
repeat?
the machine learning part and the testing part, and the other mobile application part is the made by my friend Yatambaya, and he's the team leader, but he is
Yeah, I'm
internet.
listening. Okay. Yeah, the question repeats more.
I had two questions. The first one was, who is part of your team? What are the skills in your team? And the second one is, have you considered a USSD version of your app?
Sorry, I wasn't hearing, please.
Who is on your team? What skill sets? And have you considered skill sets on your team?
Okay, I answered.
Okay, we have a graphic designer, we have a product manager, and a front-end developer, then the machine learning guy, which is my friend here who presented the presentation.
And Aminata, what was the second question? Sorry.
The question is, do they have a USSD version of the app? The app requires internet. I'm asking if they've considered to have a version where you don't need the internet, like #144# or something like this.
Mm-hmm.
Also has. Yes, as we are preparing to partner with you, so we will be providing that to individuals in the vulnerable communities as they are not having good internet connection. So we will do that later as we are doing.
Great, we're at time. Thank you.
Okay. Judges, you got the number for the previous one?
Start with number 8.
Yeah. Okay, we are at number 12, Ubuntu. Stefan, I see you're raising your hand.
Before I start, can we make sure that everyone else is unmuted who's not presenting?
Yeah. Hey, okay. Yeah.
All right. Let's go. Hi, everybody. We are Team Ubuntu. Next slide, please. We are a team of 6 people who are from Africa, north and south of the Sahara, Europe, the US, and Asia. Next slide. So what you see here is a scene from the Makoko slum in Lagos. And what we wondered when we saw this image, who of the people that we see in the image has the power and influence to make sure that other people in their community and in the image adhere to hygiene measures to prevent the spread of COVID-19. Next slide. So community engagement is one of the key things that are targeted by the World Health Organization and UNICEF. And in their COVID-19 preparedness and response plan, they have a 7-step process. And one of the key things in the process is to identify influencers. And by influencers, we don't mean people like Sadio Mane or Didier Drogba. We mean the cool kids on the block or some of the mothers from the picture before, who, if they wear a piece of cloth in front of their mouth or nose, others will follow. Next slide. So when we were wondering how to actually find these influencers, we realized that most people in Africa have access to basic mobile services, and those who don't normally know someone who has access. So we designed an SMS-based community engagement engine to find and communicate with influencers. Next slide. So we actually prototyped this with three stakeholders in mind: public health officials, the local community, and the influencers themselves. Next slide. So on the left side, you see we built a dashboard for public health officials to send voting requests out to the local community, in which the local community is asked via text message who they think the coolest person is in their community. And there's also incentives offered. Like, for example, there's the option to offer incentives, like, for example, credits of 50 text messages. Next slide, please. The local community member can then text back. And we also already implemented for the public health officials a backend that analyzes the answers. and gives a very broad overview of where they are and who actually are the most influential influencers. Next slide, please. The public health officials can then go into a dialogue with the community influencers, educating them and also receiving feedback while some measures work and why some don't. Next slide. And the community influencers just do what they normally do and talk to the community, educate them, and receive free feedback. Next slide. So I leave it to the judges to question us on what's next. Next slide. But I want to make sure that you realize that we built this tool with very easy and readily available open source and commercial solutions. So we think it can be scaled rapidly. And you can find our code on GitHub under the link below. Thank you. Next slide.
So how are you going to source the information that you communicate?
What do you mean by information? So basically, the first thing we're going to communicate in the system is just a request for them to vote. And then once we will know who the influencers are, our solution basically taps in the 7-step plan of the WHO. So we basically solving a pain point that they have in actually getting their content out. So we would hope to partner with people like the WHO and UNICEF and help them provide the content to people. So those would be the content sources in the end, to directly answer your question.
Okay.
All right, we're at time.
All right, thank you very much.
You move on to number 12.
Wait, was this? Oh, this is just your.
Yeah, it's just the appendix.
I see. Okay, so team 43, quote COVID guard. Okay, Michelle, and unmute yourself and begin when you're ready.
Good afternoon, judges and participants of Track G. We are Team COVID Guard, and we'd love to share with you our solution to help slow community transition in Africa. Next. The key problem lies in inadequate information to empower individuals and communities to reduce community spread due to limited access to information sources. Next. Now, to focus specifically on Nigeria, 58% of the population uses the internet infrequently or not at all. On top of that, there are 520 different languages spoken, presenting barriers to information spread. Next. However, 80% of the adult population owns a phone. Next. With the caveat that the majority of phone owners have a basic phone with limited features that only allow for SMS or voice calls. Next. With that in mind, our solution is an SMS chatbot providing preliminary self-assessment tool and a personalized screening and advice, as well as regular information dissemination on preventing COVID-19 spread. Next. So why COVID Guard? First, we're able to write information in the local dialects in Nigeria, including 11 principal languages. Second, ease of implementation. You can create this once and easily scale up to millions of users. And lastly, the solution allows for large-scale delivery. Next. We estimate our maximum reach to 117 million people in Nigeria alone. And assuming a 5% increase in moderate social distancing, that allows for an estimated 37,000 less COVID cases averted. The cost we estimate to be around 94 million, which can be offset by seeking sponsorship as well as selling advertising rights. Next. Now, to go over how we propose to implement this, first we gather information from the World Health Organization or Nigeria Center for Disease Control. And working in partnership with the Ministry of Health, we create this chatbot, which can then be deployed through phone carriers to the general population. With COVID Guard, we hope to slow COVID ultimately. Thank you for listening, and we open the floor to any questions. You can click next, yeah.
So
Sure.
judges, if you have questions.
This is Heather. With respect to Nigeria, do you have any evidence to suggest that the lack of information is the key problem in preventing people from complying with public health directives or engaging in appropriate hygiene or social distancing?
So I understand the question, but given the circumstances of the situation, we couldn't identify any research stating that the lack of information is the key issue. But given the severity of the situation, we believe it is appropriate to err on the side of caution. And given the ability to reach 80% of the population with information, this is something we think is valuable, even in the absence of that evidence that information lacking is the issue.
So do you have alternative in case people don't read their text messages, either because they cannot or because they just don't want to open another message?
So one of the things that we also discussed that can be implemented in the future if we see uptick in the reading is not what we would like is the delivery of messages through voice. And this would be especially, I think, useful for people that are illiterate as well as people that are illiterate or they're not reading their text for whatever reason, that if we give them a ring, which is through voice, that they're more likely to pick up.
Great, we're at time. Thank you, team number 43.
Okay, we have Team 21 Waterworks. Pinghua, you can unmute yourself and begin.
Hi everyone, we are Team Waterworks. We'll be discussing how to facilitate hand washing in densely populated areas in Africa. Next slide. A reported 80 million people do not have proper sanitation in West Africa alone. 15% and only 15% of those have access to hand washing with soap. 115 people die every hour in Africa due to poor sanitation. Notably, in sub-Saharan Africa, 41% have no hand wash facility access. Next slide. West Africa has one of the lowest sanitation coverage due to few sanitation stations because of resource constraints. It is widely accepted, hand washing is the most effective measure against infectious disease transmission and community spread during a pandemic such as COVID-19. Next slide. So these are current hand washing solutions in low income communities across Africa. They include simple hand immersion, tippy tap systems, gravity-based systems, as well as commercial options. However, these systems are not efficient or cost effective. Next slide. So we developed a low-cost, portable, efficient hand washing system that can be scaled across Africa. Next slide. So our system in use consists of a double reservoir with clean water in the base and a gray water collection. It is operated by a pump mechanism, which you can see on the foot in the video. The top component is removable for easy disposal, and the tubing is removable as well to facilitate filling. Next slide. Our system is very efficient and attains 250 hand washes per bucket, using only 40 milliliter of water per hand wash. Compared to other gravity-based systems that we showed earlier, Waterworks is 11 times more efficient. Next slide. Our Waterworks system compares favorable to other existing systems across portability and scalability, cost, efficiency, and simplicity and availability. Next slide. So we look to partner with public health organizations to implement the Waterworks system on a wide scale. We also wish to partner with local factories for mass production of the system. Our future plans involve partnering up with government and educational systems to instill hand washing habits in children. Thank you. Any questions?
The prototype that you showed us, was that done this weekend?
Yes, so one of our team members, he's located in Canada, he actually came up with that idea and put it together.
And so how would you produce it in a scalable fashion?
Yes, so our idea is that we would partner with local factories because we try to use tools that can be easily gotten in the market, such as the bucket, the plastic bucket that we showed, and a few nuts and bolts. That way, you don't have to worry about importation. So you're just using local resources.
Okay, thank you.
Any other questions?
All right. Any other questions? Thanks for your presentation. That's Waterworks team number 21.
Thank you.
Okay, so we have team 17 Better Masks. So Carlo, you can unmute and begin when you're
Sorry,
ready.
Martin, what was the number of the team that just presented?
Josh, can you help out?
It's 21.
21.
Yeah, team 21. Waterworks.
And this one is 17. Okay, Carlo, you are free to start whenever you're ready.
Great, thank you. Good afternoon. Thank you all for coming and sparing time to address the issue of COVID-19 in Africa. My name is Carlo Daldano from Team Better Mask, and I'm going to present an exciting new technology that can have immediate effect in preventing community transmission. Next slide, please. Our team members in Africa have observed that cloth masks are becoming increasingly required for general population use. The issue this brings are that masks vary in effectiveness, mishandling can increase infection transmission, and there are limited financial resources available to the general public to own an adequate supply of masks. Next slide, please. The main target of our product rollout will be populations in slums and densely populated areas of Kenya and Uganda. Next slide, please. We've chosen these areas because on our diverse team, we have members living in these countries and they will be able to assist with local connections. Next slide, please. The solution we propose is using the product Halo Film, created by our team member Mingyu Chao, a scientist at HaloMine. This product was originally created for high-touch surfaces in hospitals and wound dressings, but for this hackathon, we repurposed Halo Film to give these cloth masks the ability to kill viruses. Killing the virus on the mask will prevent transmission to this vulnerable population by reducing the chance that the individual will touch the mask covered in live virus and then spread it to another surface or pathway to enter the body. The Halo Film spray is inert during application and then activated during normal bleach cleaning process. Once it is activated, it acts as a chlorine magnet and safely keeps antiviral concentrations of chlorine on the surface of the mask for weeks. Next slide, please. Here's a simple step-by-step guide to proper use. Step 1, Halo Film is sprayed onto the external facing side of the mask and allowed time to dry. And then step 2, the mask is washed normally with bleach. We recommend washing the mask with bleach every 3 days with no change from current guidelines. The Halo Film only requires reapplication every month. The one bottle will last a family of 4 for 6 months. Next slide, please. Halo Film is a tested product that effectively kills viruses on masks. The Halo Film patent has funding from credible US agencies, and the FDA recognizes it as safe after third-party studies showed strong evidence and efficacy and safety after activated by chlorine. A study is currently being conducted on Halo Film and SARS-CoV-2. Results are expected in June 2020. Next slide, please. During this time of crisis, we plan to manufacture expeditiously and cost-effectively through China so that Halo Film can be donated to these high-risk areas in Africa. After the initial rollout, we plan to transition this to a sustainable model and produce and ship from manufacturers in Africa. Next slide, please. This is our short-term goal: raise $1 million US and distribute 500,000 bottles of Halo Film to Africa within 6 months. Next slide, please. We hope that you are excited to join our solution. With your help, these are some of the next challenges we would like to overcome. I'd be happy to answer any questions, and we're a team 17.
Great. Judges?
Yeah, can you give a sense of how much a bottle costs and whether that's within reach of a lot of families in Africa, a lot of households?
Yes. The current bottles, after through production, would cost about $2 per household, and that would be for a family of 4, or we're including a household as a family of 4, so that would last them about 6 months.
And what is the application procedure? I mean, in terms of safety for people who are not literate in Africa?
Good question. The application procedure is
for the helium, yeah. So because I'm concerned about people who may not be literate in the society and who may need to apply this substance.
So thank you. The application procedure is very simple. It's just spraying it on the outside surface of the mask, and then after it dries, they should wash the mask in a chlorine solution like they're doing already, and then after that, the halo film is active and will be able to be used. We would like to, for people who have difficult reading and with all of the illiteracy, we would like to do radio broadcasts as well to make sure the education aspect of it is adequate for the population.
Great. We're at time. Thanks so much.
Thank you.
Better mask.
Sorry. You're breaking up.
Team number?
17.
Team number.
17.
Okay.
Awesome. So I think that concludes all of the presentations. We're ending right at 2 o'clock, which is pretty amazing. So I want to thank all of you for these incredible projects. I'm really, really impressed with all the work you've done over just, really 2 days. And the judges are now going to deliberate. I'm going to stop sharing, and I will pull all of the judges into a breakout room so that they can discuss. The rest of you, we will have the final presentations at 3 p.m. The Zoom link will be posted on the Slack. So just make sure that you are in the Zoom by 3 so that you can hear who the winners are. Thank you, everyone. And judges, if you would please stay on the line. I'm going to start a breakout room.